So you have high blood pressure, and no amount of blood pressure medication has been able to drop it for you. You've been on 2 or 3 hypertension medications at a time, and it's still not dropping. Or maybe you're someone that has high blood pressure and you don't want to take the high blood pressure medications because of other risks that you're concerned about. So, what areas of your life can you improve to decrease your blood pressure? That's what I want to discuss a little today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Hypertension, or in lay terms, high blood pressure, is a huge problem in the United States, and there are many potential causes of high blood pressure. Now, high blood pressure medications address a couple different mechanisms and pathways that can drive hypertension, but there are many lifestyle and other type inducers of high blood pressure that the drugs don't impact. Another way to say that is the drugs address a specific mechanism, but if the cause of your hypertension is through a mechanism different than the mechanism that the drugs address, then the drugs will have very little benefit, if any, for you. And so I'm speaking to the people who have been on 1, 2, or 3 hypertension medications and not seen an improvement, or people that, for whatever reason, are not taking the medications and want to know what parts of their life can they impact and to see a positive change in their blood pressure or to see it come down. So some of the areas or causes of hypertension in your life that you may not be considering are the following, in no specific order. But one is estrogen-based birth control pills. If you're taking birth control and you have hypertension and you haven't been able to figure out why, it may be the birth control. Another driver is alcohol. If you are consuming alcohol and if you're over consuming alcohol, that can be a definite driver of high blood pressure. Insulin resistance is another driver of hypertension. Insulin causes water retention because of sodium retention. So if you have insulin issues, blood sugar issues, specifically the insulin resistant variety, your hypertension may be due to an insulin problem. And so the medications aren't necessarily going to address that. That'd be something you would have to address specifically yourself. Licorice drives up aldosterone, which can drive up hypertension. So if you are a licorice junkie, you may want to step off the licorice a little bit. Mercury toxicity. Mercury toxicity can drive hypertension. Well, doc, I'm not breaking the old thermometers and sucking it down. No, but you may have mercury amalgams in your mouth. And we've covered in previous videos how mercury amalgams off-gas mercury, and mercury builds up in the system. So if your hypertension isn't being addressed by other things you've tried, maybe it's the mercury amalgams in your teeth that are contributing to your high blood pressure. NSAID use, or non-steroidal anti-inflammatory drugs, NSAIDs for short. NSAIDs can promote hypertension. So if you are someone who daily can't function without your ibuprofen or your naproxen, you may want to take a look at that and see, hey, if I step down on these, does my blood pressure decrease? Sleep apnea. If you have sleep apnea, that can drive hypertension through airway impact. And lastly, thyroid function. Whether you have thyroid that is hyperthyroid or hypothyroid, your blood pressure can be impacted. And which one it is depends on if your blood pressure is high because of systolic or diastolic. Either way, you have to optimize thyroid function to decrease your blood pressure if that's the cause. So as you can see, there's a broad range of causes of high blood pressure, and the list is even bigger than this. There are a lot of crazy things like different tumors and bigger hormonal or metabolic issues that aren't as common as these that I didn't talk about today. But these are things that are very common or relatively common in everyday life or in Americans' lifestyle. So looking at your insulin levels or your blood sugar, looking at your thyroid function, considering the mercury amalgams in your teeth and are they contributing, looking at your alcohol consumption, looking at your frequency of NSAID use, and looking at your birth control pills and licorice consumption. Those are things that could be happening that you would never consider to be driving your high blood pressure that very well could be in your specific case.